Welcome. This is our third month in this series of talks. These talks are our way actually of finding meaning of the current issues that confront us in the situation of adversity. We give this as our blessing to the bigger society, blessings of insight, of creativity, and hope and courage. And I'd like to thank the faculty members of the Loyola schools and the professional schools who are participating in the series of talks this month for us. I'd like also to thank the University Research Council and the Ateneo Research Institute of Science and Engineering for putting together the talks. So again, welcome to Acts of Magis.
Dr. Ronald Mendoza is Dean and Full Professor at the Ateneo School of Government. He is a well-traveled development professional who has an extensive background in international development policy and international cooperation. He has worked with UNICEF, UNDP, the Federal Reserve Bank of Boston, the Economist Intelligence Unit, and several Manila-based non-governmental organizations. He was also a teaching fellow at Harvard University's John F. Kennedy School of Government and an adjunct professor of the Economics Department at Fordham University. Dr. Mendoza's work has appeared in various peer-reviewed economics and policy journals, and he has also published several books on international development, public finance, and international cooperation, including the Ateneo UP LaSalle book collaboration entitled Building Inclusive Democracies in ASEAN, which won the Outstanding Book Award for 2016 of the National Academy of Science and Technology. Dr. Mendoza has collaborated with government officials, academics, and representatives of the private and not-for-profit sectors to advance reforms that could improve human development, reduce poverty, and provoke more inclusive overall economic and political development. He believes that the challenge now, especially for schools of government and public administration, is to be at the forefront of advancing reforms in inclusive development and helping build a modern and capable state.
Hello everyone, and welcome to Acts of Magis, Ateneans in the Service of Society. My name is Caspidio, your moderator. Once again, we go beyond the usual virtual area of Loyola schools and bring you a guest from the professional schools. Although his school is very much close to the Loyola schools, we're very happy to feature today Dr. Ron Mendoza. Magandang hapon, Ron.
Good afternoon, Chris.
Magandang hapon. How have you been?
Pretty good, thank you. How about yourself?
We're good also. Maraming salamat, Ron, for taking time to share with our audience here in Acts of Magis your work. And we know your work is very prolific, no? And it's also nice to see you in your usual outfit, no? It stands out every time, and only very few people can pull that off. And I'm not one of them. But again, ladies and gentlemen, we're happy to have Mr. Ron Mendoza with us this afternoon. And so as we proceed for the rest of the session, may we request everyone in the G-Meet to kindly put your microphones on mute and to kindly turn off your cameras until perhaps later during the Q&A portion. We are also broadcasting live through the Ateneo FB account. So you may put in your comments in the Ateneo FB account, or for those who are in the G-Meet, you may put your questions later in the G-Meet chat, and we will share them with Ron during the Q&A. We'd like to thank again, of course, the University Research Council and the Ateneo Research Institute of Science and Engineering for bringing together Acts of Magis. So ladies and gentlemen, without further ado, Mr. Ron Mendoza.
Thank you very much, Chris, and thank you very much to Dr. Vilches, Dr. Derit, and colleagues for the kind hosting. So first, let me thank, as I mentioned, Dr. Vilches, Dr. Derit, Chris, and colleagues for the generous and kind hosting, that very generous introduction, Chris. Salamat. And also, I want to clarify that this is a team effort by the Ateneo School of Government, our senior fellows, our researchers. A lot of work went into this monitoring, and it is a service that we are providing through the Ateneo Policy Center, and we give briefings essentially to different stakeholders, including our government, to get a better sense of the types of governance challenges and opportunities that we face, especially now that we have a very trying challenge for the country and in fact the world, which is the COVID-19 health pandemic. So let me go through the presentation, which is, it contains around 30 slides, and hopefully I'll go through it in about 30 minutes or so. To first give you a sense of the global landscape in terms of COVID-19 as a disease that has impacted on pretty much the entire world. So it is now being described as a global public bad. Essentially, its negative impact transcends borders and impacts on many regions and countries. There are over 14.7 million confirmed cases as of July 22, according to WHO. And this is still increasing, so weekly we see very, very big changes on these numbers. As for the Philippines, we see about 72,200 plus cases as of July 22 as well, in terms of the COVID-19 confirmed cases. And I emphasize confirmed because there is now growing recognition that some cases are actually unreported. So there could be a degree of underreporting for COVID-19. And this obviously has implications in terms of the lingering risk that those unreported cases contribute to continued transmission. There is the statistics. I just wanted to share this with you, and I want to give due credit to the Department of Health for actually publishing these kinds of statistics. I know they get a lot of flack and criticism for the quality of some of the data, but in principle, this is the kind of practice by our public sector that we want to encourage, the kind of transparency that actually helps hold them more accountable in terms of output, in terms of performance. And so even as we know that there are many areas for improvement, kudos must go to the Department of Health, its technocrats and its staff for actually making itself accountable by making this data available and hopefully improving the data over time. So as we can see here in this slide, the positivity rate is actually has gone down from April, but it is slightly going up in the month of July. The positivity rate is actually a statistic tracked by many countries because it is essentially the rate of those tested for the disease. It is the rate that is declared positive, confirmed for presence of COVID-19. So what you would like to see in terms of the positivity rate is for it to go down because you are doing enough testing. So if you see that the positivity rate is very high, that's usually a signal or a potential signal that you are not testing enough. You can see from the graph up in this slide also that the number of daily tests have been increasing dramatically since May, which is a good sign also, and obviously something that we would like to see keep on increasing. Now, before I go to the rest of my presentation, I just wanted to clarify a framework for understanding what we are up against. And of course, this is part of the scholarly contribution of Ateneo Policy Center in understanding the impact of this disease. Now, this is a simple figure. It's actually drawing on existing work by different agencies abroad. This is the daily number of COVID-19 cases on the y-axis, and on the x-axis is time. And what we want to do is plot the number of daily COVID-19 cases and see that it peaks at a certain point and then starts to go down if and when our efforts to contain it are actually successful. Now, the goal for public policy is actually not to make it peak beyond the capability of the Philippine healthcare system. And if you can imagine, many other countries out there actually trying their best as well to make sure that the peak number of COVID-19 does not overwhelm their domestic healthcare systems. That is the same challenge for the Philippines right now. So if that domestic absorptive capability is that red line, what you want to do is to make sure that the peak does not go beyond that red line. So this, ladies and gentlemen, is the flattening of the curve that people are talking about. So the peak 1A is supposed to be driven down to peak 1B thanks to public policy efforts to contain the spread of COVID-19. In fact, this strategy is applicable to most other diseases that we want to contain, that we also don't want to overwhelm the domestic healthcare system. And of course, we want it eventually to go to 0.1C, which is when the daily number of COVID-19 cases or disease cases is almost going to zero. Now, the other issue, which is why economists like myself are interested in COVID-19, is because the means by which we are controlling this disease have deep economic implications, socioeconomic implications. Why is that? Let me just illustrate. Essentially, there is the period of the disease outbreak, which I illustrate here for purposes of showing you. It's called disease outbreak phase 1. And the goal here is to actually try and stop the increasing number of COVID-19 cases. The second phase is the crisis relief and crisis response phase. This is the point when you are actually flattening the curve and responding with different public policies to fight the spread of the disease. The third phase is the crisis recovery phase, which is conceptually and maybe in practice, the phase under which the disease, the number of COVID-19 cases actually start to go down to almost zero. And what they call the new normal, at least what I would consider the new normal, is that phase when after the disease has been controlled and what you want to do is stop it from flaring up again, you then implement certain public policies and adjustments in order to prevent the disease from coming back, right? So these are the four phases that our policymakers are now trying to grapple with as far as containing the disease. Now, the other part, which is where economists like myself are brought in, have to do with the economy. So that's the set of graphs underneath. So the first figure that I just showed you is called the epidemiological curve. So that is where folks, experts like Dr. Manolet Derit have a lot to say and a lot of expertise to share with all of us. In fact, I learned a lot from him and other doctors as far as how these curves are actually managed over time. Where we come in as economists have to do with the impact of some of the public policies, which I'm sure you're familiar with, one of which is the lockdown itself and the control of mobility, as well as the closure of many economic activities, social and economic activities. Now, you will see from this graph that what those public policies will do is actually drive our GDP downwards, because you are essentially preventing economic agents from engaging in economic activity. And so it will have a depressing effect on the country's gross domestic product, the country's output. So in the crisis relief and crisis response phase, you will see a diminishing of the GDP from 2A to 2B, if you can see those points underneath. And eventually, in the crisis recovery phase, if we are successful, we want to recover from 2B to 0.2C as we are driving the number of COVID-19 cases downwards. This is, of course, the very ideal case that we would like to see. And what we would also like to see is preventing any flaring up again of the disease. So any exacerbation again of the number of COVID-19 cases, which will have, again, another set of devastating effects on the economy if we have to close down economic activities again. I'm going to explain later a bit how we can build systems in order to lower the risk of that potential flaring up again of the disease. So I just want to show to all of our viewers a tracking of the timeline, because there was some controversy as far as the potentially delayed response to COVID-19. And if you look at the international best practice as far as containing the disease, some of the most successful countries actually managed to control COVID-19 because of very timely decisiveness in the beginning to try and implement the necessary public policies such as the lockdown and control of mobility that was needed to prevent its spread. So here in the Philippines, our story begins with the first confirmed positive case, which is a woman from Wuhan province in China. And it was reported 30 January. 31 January, the president issued a ban against arriving passengers from Hubei province, which is the epicenter of the disease. On February 5, there were 3 cases in terms of the 7-day moving average. Now, let me just explain. The 7-day moving average is an average of the immediate 7 days prior to Feb 5 in terms of the number of confirmed cases. So we see this as a good indicator, proxy indicator for looking at how many cases are actually being reported at that point in time. So on Feb 5, you have 3 cases in terms of the 7-day moving average, and the Philippines recorded its first death. Notably, the first death from COVID-19 outside China was actually in the Philippines, and it took place on Feb 5. On Feb 9, the Philippine government started to repatriate 30 Filipinos from Wuhan and 400 Filipinos from a cruise ship, which actually had the risk of COVID-19 outbreak as well. On 21 Feb, and we still have the 3 cases as a 7-day moving average, the DOH recommended declaration of a public health emergency. On 6 March, the Philippines confirms its first case of local transmission, and by this point, we have 40 cases in terms of the 7-day moving average. So the 3 jumps to 40 in the span of something like 2 weeks. And on March 9, you have 73 cases on the 7-day moving average. And by then, President Duterte declares a public health emergency. On March 11, there are now 101 cases on the 7-day moving average, and the Philippines recorded its first death from local transmission. On March 16, there are 179 cases on the 7-day moving average, and Luzon was placed under enhanced community quarantine. So essentially, this is the starting point for the lockdown for much or part of the country. On March 24, the president signed Bayanihan to Heal as One Act, granting him special powers, and by then we had 191 cases. And on April 24, 184 cases on 7-day moving average. President Duterte extends the ECQ until May 15. On June 1, Luzon is placed under GCQ, so a relaxation of some of the lockdown. And by then, you have 385 cases. And by July 1, which is the start of just this month, 1,480 cases on the 7-day moving average. And of course, you have several regions on varying degrees of lockdown. As of this week, there's about 850 plus cases on the 7-day moving average. I'm sure this has already changed because this is as of July 20. But this gives us a picture of how the disease has actually impacted our economy and has expanded in terms of the number of cases starting from January 30 until the present. And the key here is actually this period from Feb 9 to around March 16, where you see the period when we are already seeing a lot of evidence of the risk of the disease, but the lockdown was only implemented on 16 March. So this is the contentious period where experts have different views as to what essentially the government should have been doing as far as immediately responding to this disease. Now, there's a nice set of statistics published by the School of Government of Oxford University, Blavatnik School of Government, and they have actually created an index in terms of the stringency of lockdowns implemented by different governments around the world. And I won't belabor the point and over elaborate on this index, but essentially it is a checklist of what is actually controlled in a lockdown, such as big events, mobility of people, closure of firms, closing the transport system, international travel, domestic travel, and so on and so forth. And if you look at the figure here, the Philippines actually shows one of the most stringent responses to the pandemic, even though the stringency was a bit delayed. In fact, the dark color begins around March, mid-March, as we had previously shown, and it is still quite stringent until today with only slight relaxation. We can see from other countries that their stringency may have been just as strong, but they have begun to lift some of this stringency already in the interest of getting their economies restarted. This is in fact one of the challenges for the country because it seems that we have not yet lifted the stringency of our lockdown, primarily because we have not yet fully strengthened the systems that we need to be in place in order to prevent a flare-up under less stringent conditions. So, in fact, to actually simplify the policy challenge, and this is the highlighted text in the top here. The lockdown, if you ask me, is the price we pay to buy our health and social protection systems time to catch up with the disease, with any disease. So in the future, if we actually had another type of disease like this, we may have to implement lockdowns. And the lockdowns buy us time. It buys our health system time. It buys our social protection system time to catch up and get organized. The challenge with the lockdown is for a fast catch up of the system and to implement as short a lockdown as possible. So, hindi po ito pahabaan ng lockdown. In fact, the goal for a country like ours is actually to have a stronger health and social protection system in as little lockdown time as possible so that we don't end up paying such a high socioeconomic price for controlling the disease. And if you want to get examples of those countries that manage to get their systems up to control the disease and to give them the confidence that they will be able to control a flare-up, these are the countries like Vietnam, Thailand, even South Korea, of course, and Taiwan. These are countries now that are actually resuscitating their economies and recovering from the COVID-19 pandemic because they have strong systems already in place and need not implement such a draconian lockdown anymore. Now, as I mentioned, we seem to be in a situation right now where we are still implementing a very strong, quite draconian lockdown, if you ask me. And this obviously has an impact on the economy. Let me just show you what COVID-19 has done to us, and it's obviously quite sad news. COVID-19 has actually ended 84 quarters of uninterrupted economic growth from 2001 to 2020. So the last time we actually had a negative quarterly growth was during the Asian financial crisis under President Estrada. And the only time when we actually have another negative quarter of growth is during the early period of COVID-19, which obviously we already see that it's minus 0.2. So we expect actually that we will have more negative quarters because of the inability to dramatically resuscitate the economy. And this is actually one of the big secondary challenges, or if not the emerging primary challenge for the country. It's not just controlling COVID-19, but actually preventing a bigger crisis, an economic crisis, from taking root. Now, let me just show you the rapid adjustments in figures. Early on in the year, this was around April, the NEDA estimated that the Luzon-wide quarantine would result in a budget deficit of around 4.4 to 5.4% of GDP, and the economy would shrink anywhere from 2.1 to 6.6% of nominal GDP in 2020. And sans countercyclical measures, if we don't have countercyclical policies from government, they predicted that this would mean a reduction in the Philippine real GDP growth to minus 0.6. Essentially, it's a flat growth for 2020 to possible 4.3% growth in 2020. So in the April forecasts, they were still relatively positive as far as the impact of COVID-19 on the Philippine economy. by around May, they had to readjust these forecasts. And now that they got hold of more data, so they were running surveys actually of many firms during the interim, they began to estimate actually a bigger economic loss from COVID-19. And the government essentially estimated between 2% to 3.4% contraction, which is far worse than the original projection. And in fact, you will recall that prior to the health crisis, prior to COVID-19, the government was looking to expand the economy by somewhere in the neighborhood of 6%, which is a very lofty goal, which we have managed to actually achieve in the last few years. So this actually has turned what has been a very, very good economic growth track record for the country into very, very dismal performance for 2020 as far as the government forecasts go. So here, more reporting, 45-day lockdown to cost the Philippines 1.1 trillion pesos in lost output. And lawmakers actually were already recognizing that every day of lockdown cost the Philippines a lot in terms of economic losses. In this estimate, 18 billion pesos daily from each day of lockdown. So remember when I mentioned to you earlier that one of the ways to think about the lockdown is you are buying yourself time for your health system and your social protection system to catch up. Well, the Philippines is paying a very, very high price for each day of lockdown, for each day that we are buying them time. So the hope, of course, is that these systems are rapidly being upgraded and rapidly being strengthened so that they do catch up and so that we can relax the lockdown at some future point and thus end the huge cost in terms of the economic losses. And instead, because it has been a rather protracted lockdown for us, in fact, one of the most stringent and one of the longest lockdowns in the world, this is now the registered observation for the Philippines. We're seeing many businesses are closing. According to a DTI recent survey, this was just a few weeks ago, 26% of businesses closed operations in June. The DOLE estimates 10 million workers will lose jobs this year due to COVID-19. This is a huge number of workers. And of course, 5.2 million families are reported to be hungry based on the SWS survey that was released only recently. So these are really large and really deep socioeconomic costs of COVID-19. So a health crisis that turns into essentially an economic crisis. The interesting thing about COVID-19 also is that it is not just impacting our domestic economy just like other shocks that we have experienced in the past. Here, we are losing one of the support systems that we used to have in the past. Remember, if we had an economic slowdown in the past, usually what we would see, according to the literature and according to the empirical evidence, is a counter-cyclical response by remittances. So when our economy is slowing down, remittances tend to increase and tend to behave in a counter-cyclical way. This is not necessarily going to be the case in the situation of COVID-19 because our OFWs are situated in areas that are also impacted by COVID-19. And so, in fact, this built-in counter-cyclical measure that we used to have in the past may not necessarily be present for us anymore. So, in fact, the forecasts are such that OFW remittances are seen to fall by 20% in this year alone of 2020. And just to give you a sense of what that means, the expected contraction in remittances of 20 to 30% of 35 billion pesos in remittances a year is roughly around 7 to 10 billion pesos, $billion lost in terms of remittances to the Philippines. And this is actually comparable in size to the net foreign direct investment of the country in 2019, which was only about 7.6 billion US dollars. So this is in fact very troubling. And of course, the other side to this is that past crises usually affect in a major way the poor and low income population, but it generally spares the middle class. For COVID-19, it affects the poor and low income population as well as the middle class, because many in the middle class are actually in the OFW sector, and they have been severely hit by COVID-19 as well. So this is just part of our ongoing monitoring of the central government policies and the local reality on the ground. This is the kind of monitoring that is necessary to see whether our government is working seamlessly in order to have the most positive impact in terms of policy. And what we're seeing right now, unfortunately, is at least in the beginning, and hopefully it will be adjusted soon, a mismatch of central government policy with local reality. So here's one example. When the GCQ was actually implemented, so a relaxation of the ECQ, there were thousands of workers that were stranded because many Filipinos were eager to go back to work and start earning again. And yet, the transport system was not yet fully available at this time. And in fact, if you see the transport system, many of them are still decommissioned and not yet operating, and they themselves are actually eager to go back to work. And so here the image shows that many of them have resorted to begging in order to augment their incomes. So this is the kind of mismatch where workers that need to go to work actually have no transport, and workers in the transport system are actually not yet allowed to work and not yet allowed to transport those workers. So we have on those two sides a mismatch in terms of trying to find ways in order to make this slow recovery much more seamless. Here's another example of mismatch. We've had challenges in terms of releasing support, which is called the Social Amelioration Program, for many poor and low-income population, for many poor and low-income households in the country. And yet the means by which we are releasing this support appears to not yet be, at least in these early images, not yet be sensitive to the actual goal of preventing the spread of COVID-19. So this is a picture from Quezon City. I'm assuming that many of these kinks may have been responded to and adjusted and fixed by now, but at least in the early phases, you will still see that the means by which we are providing our support actually may have exacerbated the risk of COVID-19 in some places. And so when I mentioned that our social protection systems need to rapidly catch up with the disease, this is one image, this is one example showing that it has not yet managed to catch up in terms of building the systems that will provide the support and at the same time prevent the disease from actually affecting large numbers of Filipinos. Here's another example. I know there has been more or less successful transition to online for schools like Ateneo de Manila University. And thanks to the many good efforts, including the leadership of Father Johnny Go and of course Father Jet and others in our school, we have managed to make this transition very quickly and very effectively. But we cannot say the same for the rest of the educational system. This is an image in Macro, Davao de Oro of public school teachers who have had to go to the highway in order to get signal so that they could participate in webinars organized by DepEd in preparation for classes to be opened on August 24. So this already signals to us when we see these images that many parts of our country are actually not managing this transition very well and may actually be further marginalized under this new normal, under this system where we need to actually implement some innovations to continue to control the disease, but at the same time start living our lives. And so many parts of the country have the means to actually transition well, while many other parts of the country do not. And so just the point to emphasize here is that COVID-19 seems to be emphasizing the inequalities, the deep inequalities across countries. And obviously the Philippines displays many of these inequalities, being one of the most unequal in the world. Our Gini coefficient, the measure of income inequality, is actually one of the highest in the region. So what we're seeing here is just further evidence to that effect. This is another image, this time somewhere in Cebu. And you will see here a poster, presumably by the citizens who are locked down here. If you cannot feed us, free us. The spread of COVID-19 is not our fault. Stop the discrimination. So it is understandable that many of our citizens are starting to think in these terms, that in order to provide the greater public good, we all need to support diminished mobility and actually comply with lockdown measures. But at the same time, many of us are able to afford this lockdown much more easily and continue to work, which is what we have right now in many parts of Ateneo. We're able to manage this transition. But at the same time, many other parts of our economy and our society are not able to manage this transition well. And so what it does is it actually may end up exacerbating existing inequalities, such as what you see here in this image. We need to provide the support so that they too can actually manage better this particular difficult period of trying to control the disease while we have all of these mobility constraints. So these images are a bit disturbing, I have to warn you, but this actually just emphasizes, again, the presence of unreported COVID-19 cases. This is an image somewhere in Quezon City of a resident who passed away, and obviously this person was actually not in a hospital, and yet the Quezon City government picked him up and actually took many precautions because it was suspected that this person actually had COVID-19. This was reported about 2 months back, and we are still continuing to hear reports like this. And you can see here how densely populated this particular area is. And of course, the lingering concern that there is a lack of health seeking in many parts of our society. And obviously, that is going to contribute to continuous risk of a potential flare-up of the disease if our citizens do not have the comfort of actually seeking healthcare, primarily because they don't have access to it or they don't have the money to actually pay for it. So these are the images from that particular report. Now, let me mention here some good news. It's not all bad, and actually we can see a lot of good adjustments being done by some leaders, particularly in the local governments. We're familiar with Mayor Vico Soto of Pasig City, one of our own graduates in the Ateneo School of Government. We're very proud of Mayor Vico and his staff. Many of your staff, by the way, some of his staff are his classmates in Ateneo School of Government, and they are working with Vico also in Pasig City. And initially, Pasig City was actually constrained in terms of its responses because of the very rigid central level policy that was imposed on many parts of the country, and particularly in Metro Manila. And there was even talk of having Mayor Vico report to NBI because of violations of quarantine protocol. Thankfully, this was quickly sorted out, and thankfully, these young leaders are actually innovating in partnership with the private sector to actually respond in ways that solve those problems and provide the agility that we need to comply with the lockdown, comply with the mobility restrictions, while at the same time preserve the economic income streams for many citizens. So here is a partnership with Food Panda that Mayor Vico was able to swing, Mayor Vico and his team. And essentially the tricycle drivers, while they're not able to work in the same way they worked before, they are at least getting an income stream from delivering food in partnership with this particular company. So let me begin to wrap up. It's now about 30 minutes into the presentation, and I just wanted to bring us into the direction of how to improve. And again, we have seen some progress in the way that our government and our entire society has actually been responding to COVID-19, from the civil society, academe, the private sector, government, central government, and local government. There have been improvements, there are lingering challenges, but there is much to learn still and much to improve on based on the emerging good practices. I wouldn't say best practices because the crisis is not over yet, but emerging good practices that we can see from other countries and emerging lessons that we can consider. So the first overall lesson, which seems to be the best analogy we can make as far as controlling COVID-19, is we need to implement a scalpel rather than an axe. Let me just clarify this. When we refer to draconian lockdown policies, which indeed have an impact on controlling the disease, but at the same time implies a very, very high socioeconomic cost, what I like to call this is the use of an axe. Essentially, you are stopping the disease, but also you are stopping many livelihoods. So you have actually prevented one bad, but created many other bads. So perhaps the best way to do this is not to look at such a draconian and unnuanced policy, but to look at much more nuanced, much more evidence-based policies, such as what an analogy like a scalpel would suggest. No, so this is an article that we published. Actually, I worked with this. I worked on this with our team in Ateneo Policy Center, and of course, researchers also from the rest of the Ateneo professional schools, including, by the way, Dr. Manolet Deirit on a number of studies in this area. And what we're seeing is that what we need is to deploy much more evidence-based and much more nuanced strategies to control the disease, but at the same time, so that we don't end up paying such a high economic cost for that control. And so what we need is a scalpel, something very nuanced and something very evidence-based. Where can we get examples and lessons of successful scalpels? So Taiwan is emerging as one country we can learn a lot from. And if you look at the experience of Taiwan, and I'm not going to go through all of the details here, but its main strength is its near 100% health insurance access. In fact, it is evaluated as one of the world's best health insurance systems as far as coverage and access. And what this does actually is it gives Taiwanese in that society a lot of comfort that if they get sick, there is a health safety net waiting for them, so that they don't need to, so that they will actually seek healthcare rather than not seek healthcare when they're actually not feeling well. And this is going to be very important if you're going to control the spread of a disease, because the moment that your citizens don't seek healthcare, the moment that they hide their healthcare needs, is the moment that you have many, many risks out there that are undetected, right? In terms of Thailand, which is another country that seems to be successful in controlling the disease, it has a very strong track record of health campaigns, strong public information campaigns to cooperate with government, to work with the public sector and also the private sector in controlling the spread of disease, but also in terms of vaccine uptake. And it also has a very strong track record of public-private partnerships. Government working very, very well with the private sector, often in seamless ways in order to come up with the public good of a strong healthcare in the population. In terms of another country, Vietnam, Vietnam is actually known for another thing, which is it was one of the countries that immediately responded to the disease, because once it gathered information on the nascent threat that was emerging from China, it immediately went to control its border. So it was one of those countries that early on knew the risk of such a disease and managed to prevent it from actually having a large flare-up. And if you do that, then you obviously do not have such a big economic impact from the spread of this disease. Vietnam also has a very interesting characteristic, which is it has strong transparency and trust in its healthcare system. And its citizens have been voluntarily sharing personal health information via a government-launched app called nCoV. And of course, 65% of Vietnam's 96 million people have online access, and they were able to leverage this very effectively in order to provide their government the adequate data and information to act in a very nuanced and evidence-based way to counteract the crisis. Now, of course, the other side of this transparency and trust is a highly credible and trustworthy public sector that presumably protects the rights and recognizes that the citizens do not just want their data to actually be misused. So this appears to be a very, very important ingredient in terms of building systems that are resilient to diseases like COVID-19. And finally, you have what many consider the gold standard out there in terms of COVID-19 response, South Korea, and they have many, many strengths here, but I'm going to just emphasize one, which is their agile test, trace, and treat system, which we actually hosted a webinar featuring South Korean experts some months back, and obviously South Korean and Taiwanese experts, and in fact some of the lessons that emerged from these exchanges is that they learned a lot from the spread of previous diseases like SARS and MERS, and they built systems so that they could be agile in case a new disease actually emerges and threatens their country. So South Korea actually has one of those agile health systems, which enabled them to rapidly set up a very effective test, trace, and treat strategy. Now, this is going to be important also for the Philippines, because if we opened up our economy and if we did not have confidence in such a test, trace, and treat system, then we are looking at indeed the potential risk of another flare-up, and the delay in knowing this information actually again reintroduces the risk that the flare-up will be very bad by the time we actually discover it and try to stop it. So I just want to end with a few thoughts in terms of the possible components of a health sector anchored recovery. And this is just summarizing the main messages of this presentation. First is we need the technology. It's important for rapid testing, apps for tracking, real-time information sharing, and even telemedicine. We have various systems in place right now. If you go out there to the malls, if you go to Starbucks, if you go to different places, many of these many of these firms have online systems already. Many of our public sector also have online systems already, but they are not yet integrated. And so maybe there are ways to actually keep on improving. There should also be strong trust for compliance with quarantine and willingness to share information, give up privacy for the common good, and combined with strong social cohesion and no discrimination. Of course, the opposite side of trust is a trustworthy system that protects the rights of citizens and makes sure that this information is not misused. And so the question then is, do we have those systems? And do we have the strong track record that has built that trust among our citizens? So trust is not easily given, and it has to be earned over a relatively long period of time. And some countries actually have it in place and some countries do not yet. And finally, the last strategy is transform from a brick and mortar health system to a system that is much more agile and built to include a surge component that emphasizes inclusion. Let me just clarify what a surge component is. This is the ability to actually increase the absorptive capacity of our health system in case it is needed. So presently, if there is growing concern that COVID-19 is now beginning to overwhelm some of our hospitals, which is the really troubling news of the last few days, one wonders to what extent we can actually adjust our health system so that it is able to absorb more patients in case that is needed. And of course, the other part of the strategy is that as you are potentially absorbing more patients, what you want to do is emphasize inclusion so that it's not just patients who can pay, but all the Filipinos who actually need help. Otherwise, if we are only including patients who can pay, then we are still leaving a big amount of risk in terms of Filipinos who are not health seeking and potentially continuing to transmit the disease and undermining our efforts to actually stamp it and bring it down to zero COVID-19 incidents. These are some of the troubling news that we have been monitoring. So I'm going to begin to wrap up the presentation. There is now very big concern that many of our private hospitals may not be able to maintain their operations because of the lack of financing to fight COVID. So this is certainly one area that we hope our economic stimulus packages that the legislators will focus on, I understand, very soon, will try to address, because without these hospitals, we're going to find it very, very difficult to imagine that our health system has actually caught up with the disease. And Philippines is one of those countries with a large share of the healthcare system accounted for by the private sector. So here, the private sector also needs help, just as the public sector hospitals also need help. So here are more troubling news. This was reported in late May, over 300 hospitals on the verge of closure. And of course, we're closely monitoring what the situation is for these hospitals. This is another area that is well known, that the out-of-pocket costs for healthcare in the Philippines is quite high, despite efforts of reform of the past administrations. And this administration, we still need to do a lot of work in terms of improving access to healthcare. And notwithstanding the increase in the coverage of PhilHealth, and the maximum coverage now is 786,384. We do know that COVID-19 may actually cost a lot more than that. And here's one of the innovators that we have been monitoring, Mayor Isko of Manila City, who recently set up free testing centers in Manila. And this was his observation. Totoo pala na ang tao gusto niya magpa-test pero wala siyang access. Second problem is economic. Wala pera, hindi kumita. Ngayon nagkaroon ng libre, dumagsa. So this is actually a very simple innovation, but a very important reform that this particular mayor has implemented, which is to provide free testing services to the residents of Manila City, so that you actually have more of those citizens covered in terms of health services. As a final note, I'm going to end with this thought. We still have a lot of trust building to recover. And in particular, I'm going to note down a study that Dr. Manolete Derit and I recently published in this journal, where we studied the impact of Dengvaxia on vaccine uptake in the Philippines. And we can see here that the crisis of Dengvaxia vaccine, there are many lessons to learn here and many things to recover from. And soon we will actually be in talks of the on the COVID-19 vaccine. And so it is important that we learned our lessons from what we did wrong as far as the controversies surrounding Dengvaxia, because if we do not overcome those trust issues, we may have yet another round of problems as far as vaccine uptake and health seeking when it comes to COVID-19. So this is an area that we are also monitoring, and hopefully we will contribute to important reforms moving ahead, because as you probably noted recently in the news, there have been very positive signs already in some places in the world in terms of progress towards a vaccine to fight COVID-19. And so at some point in the future, we may end up in a conversation and a set of decisions in the public sector on how to access this vaccine, whether to actually finance it, make it free, how to finance that, and actually how to begin to recover from this COVID-19 health pandemic. So I have gone through a lot of information. Let me end there, and I hope I stuck to the time. Thank you very much for the chance to share these ideas with you today.
Thank you very much, Ron. Typically at this point, if we were together in a hall, you'd be receiving the applause of the audience. But for now, please accept the acts of Magis hearts. Okay, these are for you. Thank you for that
Thank you.
sharing. Indeed, it was very thorough. No, I was just thinking so many economists would be excited to be hearing all these things. Now, well, we'll jump into some questions we gathered earlier, and but we invite also our friends in the G Meet platform to type their questions in the chat box if you have any, and we're also monitoring our FB live stream. But to begin, Ron, well, what aspects of the country's economy do you think should the government focus on, maybe primarily, for recovery from the COVID-19 pandemic? So, what might be a good primary focus in terms of the various aspects of the economy?
Well, that's actually it's a very tough question to answer, and I empathize with our leaders because it's almost as if you need to hit multiple targets all at once. Almost everyone in the economy needs some form of support, some form of policy response, and so the challenge I think is to prioritize. And if you ask me, based on the emerging international good practice, the two sectors that really need to be strengthened if we are to come out of this crisis in a relatively stable and inclusive way is the healthcare sector and the social protection system. It's these two systems that need to be very strong in order to usher a more inclusive recovery for the country. If you ask me, a third area would be micro, small, and medium scale enterprises, the
Oh,
small firms. And for that, so I've spent a lot of time already talking about the healthcare sector and the social protection system. So let me spare a few minutes talking about the MSMEs. My belief here, and I've heard so many stories from my classmates, good friends, entrepreneurs, workers out there that are actually facing grave challenges right now, very big challenges in terms of their operations and their businesses. My observation here is that it is probably going to be much more effective and much more cheaper for our country to try and keep these firms alive and operating rather than to watch them close in large numbers and then watch those workers go to the social protection system asking for help.
mm,
So let me just repeat that. I think my main message to the public sector is it's cheaper and more effective to keep our firms fighting and operating because if they close, those workers will end up in the social protection system asking for help, and that's going to be much more costly, especially in the immediate and medium term when those workers stop producing for our economy because they are no longer working, and then in a full-time way start drawing down on social protection support. So they are not contributing to the growth, but contributing to the consumption. So for me, it is better to channel some strategic support to MSMEs and many of the firms that are now closing up. So it's very sad for me to hear that 26% of our firms have actually closed already. Those are millions of workers, so at least 10 million according to the DOLE estimate, that will now need help on the social protection side. And that help is not going to be cheap, and most likely it's not going to be adequate. So I think the strategy should actually be to keep as many firms operating and fighting for as long as we can keep them there so that we buy ourselves time for either the vaccine to be accessible so that we can return to some form of normalcy or for our health systems to actually catch up finally so that we can begin to open the economy in a much bigger way.
thank you for emphasizing that, Norron. And I also remember how you mentioned in your presentation that we really need to have a more nuanced set of strategies, no, rather than uh, knee-jerk reaction types, no, of strategies. Well, in the interest of time, I'll take two more questions, and I'll start with this one. This comes from our audience in the Facebook live stream. You talked about how other countries have good features. Do do we not have any of those admirable features that our neighbors have? No? Or I guess putting it in a more positive spin, what are the good things that we are doing that are similar to what the other countries are doing that are actually helpful to their people?
Thank you for that question and for the chance to clarify that we do have a lot of good things going for us. If I didn't emphasize that, then I really do want a chance to emphasize that part. One of the good things going for us is we have some very strong, very effective young leaders in the local government that are in many ways adjusting very successfully to help respond to the micro details of the crisis. Because you cannot cascade all of the policy reforms from the top down to the bottom. And in fact, one of the strengths of our systems is we have decentralization in our governance. We are giving our local governments a lot of agility and a lot of responsibility to try and figure out through their own innovations how to actually respond to the crisis. It cannot all come from the center. It cannot because the center doesn't know everything. It is not the monopoly of all expertise, and they are far from the constituents on the ground. So our decentralized system is actually a strength. On the other hand, the local governments can only go so far, right? Some of the bigger policies need to be made at the center so as to support many local governments in a big way. And that is where the strategic support for the healthcare system and the social protection system must come from an overall coherent plan to stimulate the economy and to actually protect our citizens. So the stimulus bill that is now being discussed in Congress is going to be extremely important, even though it has been very much delayed. We should have had it in place maybe some months back. But now it's better late than never, so we really need to get that thing done and implemented soon and well thought out in a way that actually tackles many of the challenges that we talked about today. But please make no mistake, there are good things that we have in place. My hat's off to many of our hospitals, both in the private sector and the public sector, that have responded in very innovative ways, including from our own Ateneo School of Medicine and Public Health. Many of these innovations will offer lessons for us so that we'll become stronger in case in the future we will have more crises like this. And as I mentioned, it is early in the crisis, and so we cannot really say that we can identify all the lessons already. But there are enough good practices to now try and talk about and maybe spread across more parts of the country. So that's sort of my response there.
Thank you for emphasizing that, Ron. Maybe again, it's good that suddenly there's a bit of a surge of questions. We'll gather these and maybe forward them to Ron, and maybe it can be part of his next sets of articles. No? But for now, we'll end with this one. This was towards the end of your presentation. You mentioned that trust. Okay, trust is an important component of a health sector anchored recovery. Okay. So, well, what are ways to build that public trust on the government to encourage people really to share their information, and really work with the government? How do we build public trust?
That's a very important issue and a good topic to try and end the discussion on. I have so many thoughts on this. I would not claim to actually figured out most of what's going on as far as building trust, but let me share a few thoughts. First of all, I do not think that the strategy to call our citizens pasaway and the strategy to keep on blaming our citizens for failures is actually working in our favor. I think it is reinforcing actually a low-level governance situation that is going to backfire on us if we actually overemphasize this kind of messaging. It is not a conducive environment for trust building if you keep on blaming the citizens. We must look at our system. We must acknowledge shortcomings in the system, and we must start to address those shortcomings in a very evidence-based way. And clearly, the evidence is suggesting it is not the lack of discipline that is the problem. It is many other things that need to be addressed. So I think the first step in terms of trust building is to stop blaming our citizens and start looking at the real problems of the system. Start owning up to it and start fixing it. And in fact, many of our citizens and many of our stakeholders are ready to help if that kind of messaging is actually taken on. We are happy to help and ready to help our public sector and our private sector so that we can collaborate to fight this disease. But it cannot be under an environment where we keep on blaming citizens, number one. Number two, the strategy of collecting information must be based on trust, and it must be based on social cohesion. It cannot be based on tapping chismosas in different parts of our communities as far as the communications of some in the public sector have been shared recently. This is an actually short-sighted strategy that will also backfire on us. Citizens reporting on each other actually took place under Operation Tokhang. There was the encouragement to report other citizens who they suspected were actually using drugs or were suspected of being drug dealers. Creating an environment like this, creating a Gestapo-like environment, is not going to be an environment that is conducive to trust building. In fact, it is going to be an environment that is conducive to weak social cohesion and weak trust in the public sector and weak trust in each other, weak trust in your neighbors that you think might actually be reporting you and not thinking of you in terms of helping you, but rather undermining you. That is really essential that we stop that messaging, I think. And the third point that I would like to say is, obviously, there is a lot of areas where our public sector can still do a better job. But we do need to extend our appreciation of the challenge at hand and understand better our role in this. So I stand with our public sector reformists. I stand with our DOH. They have actually opened themselves up to performance, a greater understanding of performance by making this data available. That kind of transparency is to be supported. Even though we are critical of their shortcomings, we must be ready to help them because they have already taken the first important step of transparency. Showing this data, obviously the data has flaws, obviously the data can be improved on, we need to work with them. So part of this, in the last point that I would like to make is there needs to be a mutual trust. We need to begin to start trusting our public sector again, and the public sector needs to start trusting our citizens again. If we don't manage that, then we will continue to be weak against COVID-19. It will be very difficult to imagine this country and this society coming out of this without high socioeconomic costs if we do not reestablish that mutual trust.
Thank you very much, Ron. And I think, yes, that is a good way to sort of close the session, but it's a good way to proceed coming from this session on thinking about all these things. Because the question I guess now is, okay, I want to trust you, you want to trust me, but who starts being trustworthy first? No. And I guess that's all of that's the invitation to each one of us as individuals and as institutions. But again, unfortunately rather, we have limited time. But thank you very much for spending your afternoon with us, Ron. And again, to the audience, many of the works of Ron Mendoza are available at the artium.ateneo.edu. All right, and you may also email him. All right, for if there are collaborations you'd want to do, and if you have other questions. So again, thank you very much, Mr. Dr. Dean Ron Mendoza. Please do take care. And for our audience, we'd like to give you a sneak peek to tell you rather a bit about what will be happening for the closing session of Acts of Magis. And likewise invite Dean Ron to be with us next week. On Thursday, so we'll be having Acts of Magis on Thursday, July 30, also at 4 p.m. But our guest presenter is no less than Father Jet Villarin. So to close the session, the season, the first season of Acts of Magis, we will be having Father Jet with us next Thursday, right? Instead of Friday, Friday is likely to be a holiday, so we'll be having it on a Thursday, 4 p.m. And so we hope to see you all there. Thank you very much for joining us. This is Chris Castillo, and this is Acts of Magis.